Good afternoon, everyone. Such a gorgeous day here. Thank you all for coming in. My name is Lisa Brown. I'm Vice President Advancement and External Relations with Memorial University. And to start, I'd like to acknowledge that our campuses and the land we're currently on are situated on traditional territories of diverse Indigenous groups. And I acknowledge the histories and the cultures of the Beothuk, Mi'kmaq, Innu, and Inuit. We also have a number of special guests here today, and I'm going to introduce them as well. They will also be speaking. Most of them will be speaking. The Honorable Jean-Yves Duclos, Federal Minister of Health. Welcome to Memorial University. Very nice to have you in our province. Joanne Thompson, the Member of Parliament for St. John's East, and my personal member, actually, I should note, Joanne. The Honorable Tom Osborne, who is Minister of Health and Community Services. It's going to take me a while to let that roll off the tongue. As of last week, he was the new Minister of Health. Prior to that, he was our Minister of Education. So congratulations on your new portfolio, and thank you for your leadership within education. We also have Dr. Brendan Barrett, who is here, a Principal Investigator, NL Support. I also want to acknowledge my VP colleague, Dr. Neil Bose, who is the VP Research. And we have many people joining us from the university community, including members of our leadership team and research community, as well as those joining us virtually today. So these sorts of announcements are always joyous, really, and really we want to see some joy and some happiness here. So we're going to announce the renewal of funding for the Newfoundland and Labrador SPORE Support Unit, also called NL Support. And support stands for Support for People and Patient-Oriented Research and Trials. And NL Support helps researchers with meaningful engagement of patients in research, expertise in knowledge translation, sharing research and evidence in different and impactful ways, and access to expertise in research methodologies. And, you know, just this morning, I was at the Engagement Academy for University Leaders at our Signal Hill campus. And we were talking about just this sort of thing, the engagement of people. And particularly within this healthcare sector, it's so important to engage patients in their own care and to understand the side that they bring to their own care. The NL support team includes research and evaluation program, quality of care, NL, and supporting infrastructure for the Center of Analytics, Informatics, and Research. And here at Memorial, of course, we're the only university in the province and one of Canada's top 20 research university, and we play a critical role in fostering approaches to research that have a real impact on people of our province and beyond. And so I'm really delighted to invite Minister Duclos to provide more details of today's announcement. Minister Duclos.
Thank you, Ms. Brown. Thank you, Lisa, for your kind welcome, and good afternoon, everyone. And thank you, everyone, for being here today. Bonjour à tous et à toutes. I'm very pleased to be here at Memorial University in the company of my dear colleague, Joanne Thompson, who is not my member of parliament, unfortunately, but is my dear colleague from St. John's East. Thank you, Joanne, for all that you do for this community and all that you do for your community in Ottawa. You know, as you know, and I won't reveal any secret, I think you're a very strong and credible advocate on health and healthcare for obvious reasons that most people know. And we are delighted and fortunate to have you. I'm also honored to be visiting the traditional territories of the Indigenous people that have been welcoming to us, the Beothuk, the Mi'kmaq, Innu, and Inuit people of this province. Also very pleased to be in your company, Minister Osborne, the first time we meet. And that's not because we didn't try earlier, it's because you were just appointed just a few days ago. So congratulations, as Ms. Brown said. We are fortunate. I am certainly very fortunate to be able to be working with you in the future as Minister of Health and Community Services. Mindful of the fact that I had a very good relationship with John earlier, and therefore we look forward to continuing on that good and solid relationship with the government of Newfoundland and Labrador. Now, as we said, as we heard, today we're here to celebrate a very special collaboration between the federal and provincial governments, focused on addressing the needs of patients through research. So a great triangle connecting scientists, patients, and caregivers. And no one indeed knows better than patients, their families, and their caregivers what is most important to them when it comes to the healthcare they receive. That is because patients bring valuable firsthand experience that informs the research process and can lead to new and better ways of delivering care. Through what we call patient-oriented research, we are indeed able to transform the role of patients from a passive receiver of health and healthcare services to a proactive partner who helps shape research and as a result helps shape healthcare services. Since 2014, the Canadian Institute of Health Research had been working with provinces and territories on what is called a Strategy for Patient-Oriented Research, SPORE, supporting the Newfoundland and Labrador Support Unit. That's why we are therefore so pleased to be here together today on the campus of Memorial University to announce $9.7 million in new funding from the federal and provincial governments that will allow the support unit to build on its earlier achievements and successes and continue this important work for the next 5 years. Depuis sa création, l'unité support a fait des progrès considérables dans l'instauration d'une culture de recherche axée sur le patient et dans la promotion d'un système de soins de santé plus sensible et plus conscient des besoins des patients et de leurs familles. The past few years have been an exceptionally busy time for the NL SPORE support unit. From helping to create a dashboard to track quantities of personal protective equipment at the outbreak of the COVID-19 pandemic, to helping ensure the voices of patients, families, and caregivers was reflected in the important work of the Provincial Health Accord Task Force, the NL SPORE support unit has risen to the occasion every time. Now, while I'm here, I also wish to talk to you briefly about vaccination. The most recent numbers show us that the last 3 weeks alone have seen increases worldwide of COVID-19 of about 30%. And wastewater data in Canada show also an important increase in the country as well, which is what we knew, that is the COVID-19 pandemic is not over and will probably be with us for a little while. The majority of Canadians have gotten their first 2 doses of COVID vaccines, and that has allowed to save tens of thousands of lives in this country and avoid mass numbers of hospitalizations. And I would say that we are very proud in particular of the people of Newfoundland and Labrador that have risen very high and have been leading the country in that regard of vaccination, with higher rates of 2-dose vaccination, pediatric vaccination, and booster vaccines of all provinces and territories. So Newfoundland and Labrador is the easternmost province. It's also the most successful province when it comes to vaccination of all sorts and all types. And I think it deserves to be said and told, because it not only is it a signal of success, now the way we've worked together over the last year and a half in doing that, but also an example and a model to other provinces and territories. This being said, the immunity for vaccines is waning over time. And now is time to get the 3rd or even the 4th dose, depending on where we are in the country and where we are eligible for. Our recommendation is that all Canadians should be up to date in their vaccination, which means that you should get a booster shot no later than 9 months after your last vaccine, regardless of how many booster doses you have received already. We know that vaccination reduces the risk of infection, transmission, severe outcomes, hospitalizations, and long COVID as well. High rates of vaccination are also important to protect our most vulnerable people, and to protect against the large societal disruptions and costs that can incur, like disruptions like lockdowns. And that's why it's essential that Canadians remain up to date with their COVID vaccination. In conclusion, let me speak again about the success of the support unit, which would not have been possible without the commitment of the government of Newfoundland and Labrador and the leadership of Dr. Brendan Barrett and his team. I want to thank all of you and Minister Osborne in your new role, Dr. Barrett and your team, and everyone else here today and elsewhere to have contributed to the success of the support unit over the last few years. And Joanne and I look very much forward to the continuing and increasing successes that you will achieve with today's news and today's support. Thank you very much.
Down. There we go. Thank you so much for that wonderful announcement, as well as your words on vaccines. I'm now pleased to introduce Minister Osborne, who will speak on behalf of the Government of Newfoundland and Labrador in his new role as Minister of Health and Community Services.
Well, thank you very much. And thank you, Minister Duclos. It's certainly a pleasure to have you in Newfoundland and Labrador. I know the federal government on many fronts has been a solid partner with this province. This is my first official role in my new capacity as Minister of Health and Community Services. And I'm delighted to be here today to announce the province's portion of funding for this important work in patient-oriented research. The Government of Newfoundland and Labrador is investing $4.8 million over 5 years to support the ongoing work of the province's SPOR support unit. Our government has made a commitment to improve healthcare delivery and health outcomes for all Newfoundlanders and Labradorians in all regions of the province. Health Accord NL was created to reimagine our healthcare system, to look at how we can best deliver services so that we can better meet your needs in your communities. It is about providing you, the patient, with the best healthcare system possible. Newfoundland and Labrador spends more than any other province on healthcare. Our investment in healthcare is 36% of our entire provincial budget. Yet we continue to have the worst health outcomes of any province in the country. This simply isn't acceptable. We are committed to finding innovative solutions. Doing the same things time and again without seeing the results is not working. It's not good enough. We are well positioned today to make the level of change that is required to improve our healthcare system. And the work of SPOR support can help with that. By investing in Newfoundland and Labrador's SPOR support unit, we will foster new and better ways to effectively support healthcare delivery, to further develop health policies, and to improve patient care. We must ensure that every action we take in healthcare delivery is one that will provide patients with what they need when they need it. We must take steps that are evidence-based and results-driven. I am delighted to note that NL Support's lead program, Quality Care NL, played a pivotal role in the development of Health Accord NL, operating as the secretariat for this work. I know that this project is in good hands. I'd like to congratulate Memorial University for their hard work and dedication on this project, as well as the federal government for your support. I look forward to the results from this important research. Thank you.
Thank you very much. Our next speaker is well known, I think, in this area, our Member of Parliament, Joanne Thompson. And Joanne is certainly well known for her work in healthcare, particularly working with equity deserving groups. And we're very grateful for your leadership and that you've continued to do that at a federal government level. So welcome, Joanne.
To begin by saying thank you, Lisa. It's a real pleasure to see you at these events, and I certainly am very grateful for the work that we did together. So thank you. And I am delighted to be here with Minister Duclos and to join you in the celebration of the Newfoundland and Labrador Support Unit based here at Memorial University. The support unit is an incredible example of federal-provincial collaboration. And I realize that's been said before, but this is really a living proof that we work incredibly well together. And it is in that partnership that we're able to do things that are innovative and I believe make tremendous differences. And thank you to you, Dr. Barrett, and your team for your hard work, engaging patients and to understand their needs and focus research on addressing them. This project is all about patients, and I want to take a moment to acknowledge the contribution of all the patients and families who have contributed their time, expertise, and experience to the support unit. This includes the members of the Patient Advisory Council and patients who have supported in support units many research projects and engagement activities over the years. Your voice has been essential. You have helped strengthen our healthcare system, and you have improved the quality of care for people of this province. I also want to highlight the work of the support unit in training students in patient-oriented research. With your support, these students are becoming leaders in their fields and will make a difference in the lives of patients. I am so pleased that you have received this new funding and will be continuing your vital work in making healthcare better for the people of Newfoundland and Labrador. Thank you.
Thank you very much, Joanne. And our final speaker is Dr. Brendan Barrett, Principal Investigator of NL Support. And I know for many people who work who live in this province, Dr. Barrett is very well known for all of his work in healthcare for a long time, and he continues to do it and is held in such high regard. Thank you, Dr. Barrett, for all of your work, and I invite you to come forward.
Thank you, Lisa, and also to all the prior speakers for your encouragement and your congratulations to us. We certainly appreciate that. And on behalf of the entire team, many of whom are here, we have staff, patient partners, and researchers. We are very grateful for this ability to continue with the funding. Since 2014, the NL Support Unit has been engaged in trying to develop a culture of patient-oriented research in the province. And together with our patient partners and the people who've participated in the training opportunities that we've offered, we feel we're moving in the right direction for that. There's also been mention of our implementation science arm, the Quality of Care NL, which is pretty important to how we engage with the health system and in the future also with the social care system, because we feel these are integrally involved with each other, and you can't really have a good health outcome without strong social determinants of health. This was indeed underlined by the work of the Health Accord NL in its recommendations. After today's announcement, I hope you'll get a chance to look with us at some of the examples of work that we've supported over the years. I'll certainly be happy to show people around and just illustrate small bits of the impacts that we've been able to achieve so far. Today's funding announcement will absolutely allow us to continue with this type of work. The Quality of Care NL program really is engaged in trying to ensure that the evidence is there behind decision-making to improve health outcomes. And our motto from the outset has been right intervention for right person at the right time. We've also had a focus on avoiding low value care. In other words, not spending money or resources on things that aren't really going to be important for health outcomes. Our programs have really functioned as a catalyst within the healthcare system, and we're hoping to stimulate and work with the provider groups and the public in developing a learning health system. This is a term that has been promoted, I would say, by the CIHR in its second phase of SPORE funding. And it really is an acknowledgement that people need to learn from how they behave. So we will be interested in developing new data sources, including at the coal face, using those in learning cycles, trying to engage providers and the public in helping the health and social systems determine their priorities, and then focus our efforts on the appropriate learning cycles and their implementation of results if they're positive. In the work carried out so far, we have, in our focus on reducing low value care, been somewhat successful, we believe. We focused on, for example, provider behavior in rote ordering of tests that weren't terribly necessary. And to our best estimation, we probably were able to come up with cost avoidance of at least $3 million over 3 years during those projects alone. Now, as part of the learning health system for our province, quality of care, as mentioned, was the Secretariat for the Health Accord, and that provincial task force has completed its work, has delivered its recommendations and a blueprint for potential implementation pathways to the province. And we'd be happy to continue to engage with the further of that work, including the evaluation of any changes that are made. Our training and capacity development program will continue and will include a focus on equity, diversity, and inclusion. This is also very important, and we recognize that within the province there are many areas where people don't have the same advantages as others, and we will try to ensure that in all we do and everything we support, that this lens is kept in mind. In addition, we are quite interested in working with Indigenous communities. We've had some opportunity to do this in the past. For example, we had a funding call for Indigenous communities as part of phase 1. The group that ultimately participated in that work were from Labrador, and they decided that they would be interested in looking at end-of-life care and a culturally appropriate model for the Innu in that community. So with our support and engaging a researcher here at the primary research unit, they carried out that project and were able to come up with a product that I think they were happy with. So we're just working on a second funding call with the Indigenous communities right now to see if we can support further work that would be of priority to those groups. The Centre for Health Information is where we get a lot of our data from. It's undergoing a variety of changes right now, but they'll continue to be a necessary partner for us. And we're interested in working with the National Data Centre as well to try and merge together as many sources of health-related data as we can. And further along the lines of the Health Accord, we need to try and work out some of the social indicators and how these can help us to focus our efforts on ways to improve health that aren't really just traditional healthcare delivery. The impact of policy and practice change will certainly be necessary to measure, and I think we're certainly poised to participate in that effort and recognize that there'll be many areas where we need to partner with others in academia, in the non-governmental organizations, and in the private sector to try and really fully understand the impact of changes that are made. We also work with other SPORE-funded entities. These would include the likes of the new national training entity, the SPORE Evidence Alliance, some of the chronic disease networks, the primary care networks, and the innovative clinical trials groups. And I can explain to people afterwards what some of those engagements have been, but this is certainly a necessary thing to try and integrate the work of all the aspects of the SPORE program, which is quite diverse and spread across the country. Our collaboration then will ensure that knowledge is both effectively generated and shared, and that we take advantages of learnings across jurisdictions as they emerge. We're going to consider the future beyond the next 5 years, of course, because we recognize that this funding is probably just for 5 years and that we need to have a sustainability plan. And part of the sustainability plan will emerge from our training and capacity development, where we have a cadre of people who are fully engaged with the culture and practice of patient-oriented research. but also I think through the development of the Health Accord, we're obviously focusing on the next 10 years as well. The investment by the Government of Canada and Government of Newfoundland and Labrador have helped to make patient-oriented research a reality in Canada by allowing patients to have a say, by supporting researchers who want to engage patients, and providing evidence that underlies decisions that everybody needs to make to improve health for all. I want especially to thank our patient partners, including all those on the Patient Advisory Council. As was mentioned already, they have been really important to our work. They've learned, I think, as they've gone along, how they can help support patient-oriented research, but equally well, it's a two-sided coin. And we've been very much in the learning mode as well about how best to work with patients. And we use that term for members of the public with an interest and background or experience that they can bring to the table. So finally, I'd like to sincerely thank the CIHR for their leadership in advancing the strategy for patient-oriented research, as well as the Government of Newfoundland and Labrador for their commitment to helping us to continue with this important work. Thank you.
Thank you, Dr. Barrett, and to everybody associated with NL support in any capacity. It's through your hard work and dedication that this is really validation of your work, I think. So thank you very much. So thank you to the Government of Canada, the Canadian Institutes of Health Research, and the Government of Newfoundland and Labrador for your investment here today. And that concludes the formal part of the ceremony. Again, I do hope that you'll take advantage and take a look at some of the projects that have been worked on. I myself have worked on a project a number of years ago when I was with a community organization, and I've seen firsthand the impact that it can make when you engage patients and that you look at evidence-based outcomes. And so that's really critically important. So please do take a look at that and invite our guest speakers for the usual photo op. Thank you everyone for coming.